Yes, we are live. It's day three of the Autism Renewed Conference 2025. Welcome, welcome, welcome. It's good to be here. Thank you, everyone who has joined us from day one, day two, and now today is the final day. Of course, final day we save the best for the last. How has it been? How has it been? If you've been here with us, we want to know how the 3 days have been. Thank you, everyone. We've gotten very good feedback from our community, from people who have been able to join us for the 3 days. I just want to be sure that we are live on all our platforms. We are ready to go. Okay, I think we are live. Thank you everyone for joining us. My name is Dr. Lola Okelwa, and I'm the founder of Autism Renewed. Welcome to the day three of the Autism Renewed Conference 2025. And of course, the theme of the conference is building bridges. Yes, how to help children with autism to catch up and to thrive. But of course, not just children with autism. If you have any child with any form of developmental delay, this conference will be of great benefit to you. So thank you and welcome. And we'll just get right onto it. I'm just going to share my slides. So, yes, we are here at the Autism Conference 2025. We are talking about building bridges today, helping children with autism to catch up and to thrive. Okay, a quick, a little bit about me. I know I have my, my bio somewhere. I don't know my team. Yeah, I just have like anyway, a little bit about me. I'm a trained medical doctor. I'm a global autism expert. I'm a behavioral analyst, and I'm also a tech transition expert. I work with parents of children with speech delay and autism and developmental challenges on how to navigate and to thrive. I think my team has my bio somewhere, but I don't know if I have time to to play that now. Of course, I have vast knowledge in language development, nutrition, and behavior management. I'm an advocate for joyful learning, an expert in also helping parents to create the right home environment to enhance learning and development. I believe in putting the power in the hands of the parents because I believe that a well equipped and informed parent becomes a parenting advantage that will help a child to navigate challenges and to triumph. And of course, my lifelong goal is to live a life of fulfillment and not survival. So that's a little bit about me. So the aim of today's session is to empower parents, caregivers, educators, and professionals on how to support children with autism and other developmental challenges. I'm going to share practical strategies for helping children to catch up and thrive. I'm going to focus on building bridges for communication, for learning, behavior, social skills, and life skills. So we're going to be shifting our focus away from delays to growth, progress, and to thriving futures for our children. So, as a way of introduction, we're going to be going through a powerful shift. We're going to focus on from focusing on just delays and challenges to focusing on building intentional bridges that help children to move forward. So, when we talk about bridges, we're talking about practical system strategy support that can connect a child from where a child is now to where they can be. And if you think about a bridge, for example, a bridge is something that connects two points and it gets you from this point to the other point. So when a child has developmental delay or challenges, which children diagnosed with autism often have, there's like a break in that process. There's like a gap. So the concept of building bridges is how do we get them from where they are to the other side where they can gain skills, where they can thrive, where they can progress in their developmental milestones. So we explore how to create bridges in communication, learning, behavioral regulation, social development, and life skills, and how small, consistent effort can create real and measurable progress over time. So let's lay some foundations. So in terms of laying the foundation, let's talk about understanding developmental delays in autism or children diagnosed with autism. Of course, every child is different because even though three children may have the same diagnosis, but the manifestations or even the extent of what we are dealing with may be different. That's why we often hear things like, "Oh, it's a spectrum." So, what do developmental, or what does developmental delay mean? When it comes to developmental delay, we first of all have to examine what we call developmental milestones. Excuse me. So developmental milestones are milestones that we all go through in our process of development from when we were babies, infants, as we grow to adulthood. So of course we have like five major areas, depends on the classification, but there are areas in which we look at milestone development. So we have the language and communication, we have the cognitive, we have the social skills, we have emotional and behavioral, and we have the motor skills area. For the motor, we have the gross motor and the fine motor. Gross motor has to do with things like walking. Of course, when we are talking about milestones, before you can walk, you talk about neck control, sitting up, crawling, standing, then eventual walking. That's the gross motor component of developmental milestone. Then we have the fine motor. Fine motor has to do with things like writing, things that have to do with the small muscles of the hand. So activities like writing are fine motor skills. So for all these milestones, there's a way in which these milestones are supposed to be developed progressively from when a child is born to when they grow into adulthood. So, for example, when it comes to language and communication, of course, when you first have a baby, the baby is not talking, but of course, the baby after a while, the baby can maintain eye contact. The baby starts start cooing and making sounds, and after a while, the baby starts responding. After a while, then you now start hearing mama, dada. Then they build up language like that. So that's milestone developmental milestone development in the area of language and communication. Of course, I've talked about the gross motor, sitting down, crawling, all the motor skills that they will need to be, and eventually they start walking. Of course, when it comes to the social things like interaction, like initially the child, when the baby is born, you notice that sometimes they're not even aware of the environment or aware of you. But after a while, they start maintaining eye contact. After a while, when you call their names, they will move to where you are, or they hear a familiar voice, they will turn and respond. After a while, they start smiling. After a while, they have joint attention, meaning that they look at you when they are talking to them, and that's a form of social interaction. This is what builds up later on to our everyday social interaction with people. So I'm just laying a foundation that's how developmental milestones will progress. So of course we have different age, different ages, what a child is supposed to attain. Of course, every child is different. So some children may be a little bit delayed or not achieve according to the standard. So when we're talking about developmental delay, so it means that a child is not attaining their milestones at certain certain ages. I mean, at this age, they're supposed to be doing this, they are not doing this. So that's what developmental delay means. Okay. And children diagnosed with autism often experience developmental delay in areas of language and communication, social skills, even behaviors, and sometimes even learning. But of course, every child is different. Some children may not have delay in one area, but they will have delay in another area. And what delay will even look like in an area. For example, even when it comes to language and communication, there are different ways. Some children have receptive language delay, some have expressive, some have even the processing, when it comes to processing language. And most times, children with autism, even when some of them have language or are verbal, they tend to have challenges with social use of language. So there's a difference between social use of language and just being able to speak. So that's why you sometimes hear parents who say, "Oh, my child can sing, my child can say the alphabet, my child knows all the songs that we sing everywhere, but my child is not communicating or using language in everyday." So, and I tell them most times, that's not functional use of language, that's not social use of language. So even if a child can sing, most times they are cramming what they are hearing in their environment and they're just regurgitating it. But what you're looking for is a child's ability to use language in a functional way, in a social way. That means to interact with their environment, to interact with people, and to be able to request for their wants and needs and be able to socially interact. So when there's a delay or when this is not happening, we say there's a developmental delay. So I'm laying this foundation because when we talk about building bridges, we are trying to build bridges across this delay or these challenges that children are having. So common areas I mentioned: speech, social interaction, behavior, academic, even life skills. And this can be due to different reasons. Okay, why early intervention and intentional intervention matters? Because when it comes to milestones, I explained that milestones are progressive. So a child will be able to do this, then they'll be able to do this, then they'll be able to do that. So when milestones are progressing, the skills that a child will require would increase. So for example, a 2-year-old now, the skills that a 2-year-old will need will be less compared to the skills that a 5-year-old will need. Okay, so why it's important to be intentional about intervention and to start early is because if you don't deal with some of those delay, as the child progresses, the gap will begin to widen. So, for example, if a 2-year-old, for example, is having challenges communicating, but how many things does a 2-year-old really need to communicate? How do I put it? The demand for the communication is not as much as when a child becomes 6 and he has to communicate in school, has to interact in school, has to learn in school, be able to answer questions and respond. It's higher. Also, when we talk about academic or learning challenges, a 2-year-old may not necessarily need to read. So you may not necessarily see it as a challenge. But when the child now gets to school, they are 6, they are 7, they now require these skills. It becomes more obvious. But the interesting thing is this: sometimes the gap that you're seeing when the child is 6 and 7 did not just manifest when that child is 6 and 7. Some of those gaps have been there even when the child was young. But sometimes, because we are not able to identify um, the right things when we're measuring milestones, we may not know. So a child that was not cooing, that was not maintaining eye contact, that was not responding, that was not interacting appropriately when they were 1 or 2, you may not easily pick it until when they're like 4, 5, when you really need those interactions to be obvious. So that's why early intervention matters. So that when you pick the deficit or the delay early, intervention can commence, assessments can commence. Of course, most countries will not do an official assessment until a child is 2 or 3. However, what intervention looks like when a child is 6 months, 1 year, of course, is different from when a child is 4. So when we're saying intervention should commence, what that would look like will be different. My own belief or my own policy is this: as soon as a gap is noticed, whether a child is 6 months, a child is 6 months, 1 year, and they're not having the milestones they should have developed, intervention should commence. Of course, what that will look like at that age will be very different compared to when a child is 2 or things like that. So yeah, so every child's journey is unique. I mentioned that. And of course, but progress is possible. With the right support, children can make meaningful progress and thrive in their own way. So next, let's look at, sorry, excuse me, the building bridges framework. I'm talking about the buildings bridging framework. So I talked about what the bridge is earlier on, a connection between where a child is and where they need to be. Sorry, excuse me. A connection between where a child is and where they need to be. Of course, a bridge makes learning and skill acquisition easier and more accessible. So bridges can be things, tools, systems, routines. So when we are building bridges across the challenge that the child has, we focus on progress and not perfection. We need to focus on progress, set our expectations correctly. So examples of bridges, I will say examine in later details. Picture cards for speech. Remember, we're building bridges across the different milestones that the child is having challenges with or their developmental delay. Things like for language now, picture cards, I talked about visual schedules, sensory tools, social stories. I'll go into detail as we progress. Every bridge brings a child closer to thriving because it helps them to be able to overcome and to thrive. So let me give another example. When you think about someone who has visual challenge, most of us know short-sightedness, long-sightedness, what do we do most times when you go and see your eye doctor, your optometrist, optician, or your ophthalmologist? They say, okay, the person needs what we call spectacles. Most of us know it as glasses. So when they give the person the spectacles or the glasses as we know it to wear, what happens is they're not able to see. So a child was not able to see the board before. But now, when they start wearing the spectacles, they can't see the board. Those spectacles are like bridges, building a bridge across the challenge, the visual challenge that they have. to now help them to be able to function and be able to see. Do you understand? So that's the same concept. When a child has challenges, we want to build bridges across the challenges so that we can help them to be functional and to be able to thrive. However, I want to mention key mindsets for parents, for educators, and for caregivers. Key mindset that can help a child to thrive, focusing on progress over perfection. Remember, I talked about different milestones for different ages, but sometimes some children need extra help. So the fact that your child is not meeting that milestone, focus on progress. So when the interventions are being put in place, we want to focus on progress over perfection. Collaboration over isolation. So collaborating with the right professionals and the right people. Patience and persistence. Patience is very important. Then learn to celebrate small wins as a child is progressing. So let's move further to practical strategies to help a child to catch up and to thrive. So we're going to talk about communication now. We're going to talk about practical strategies to help to enhance communication, building communication bridges. you know. Then to even start with, when we talk about communication, most of the time we hear speech delay, speech delay. The truth is that when it comes to speech, language, and communication, they are used interchangeably. However, they are quite different. So speech is just like the words that you're saying. Okay. Language is like like let's say a collection of words that we're now using to interact. While communication is the ability to how would I put it, to interact back and forth. So even though we use those words interchangeably, we say speech, we say like speech is delay. Most of the time we use them so that people are able to relate what we're saying. Because someone can have um challenges with speech that is not really a language thing. So for example, you see some people have maybe problems with their intonation, pronouncing some words like R or those kind of things. They have intonation or H, they have the H factor. Those are like issues with speech. Okay. When it comes to language, someone's ability to be able to use words, to communicate. So there could be a language delay in that. So, but the focus always should be communication. So communication means that I'm able to express myself and I'm able to interact appropriately with words. However, that's why we hear things like verbal communication and non-verbal, because communication is not only verbal. Communication can be non-verbal. So you can use your eye. Most of us know you can use your eye to communicate. I can use my eye to interact. I can use my eyes to pass in my message or my body language. So when a child has challenges with speech, language, or speech delay, language delay, to just permit me to use the word interchangeably so that for people to be able to relate. But like I said, if you want to really please them, they are really different. So that's why I said it that speech is not the only form of communication, because communication can be verbal and can be non-verbal. Okay, so what's the focus in language development is communication. When a child has challenges with communicating verbally or using words or speech to communicate, we can begin to build bridges using other ways to be able to complement for that while working on their development of language and speech milestones. Okay, so you need to understand your child's current communication style. Some children will communicate through gestures like pointing, holding your hand to get things, and things like that. Okay, so we build bridges using alternative forms of communication, things like sign language. It's important because the first thing is that you want a child to be able to communicate first. So I tell parents, if your child has a speech or language delay or challenge, the first focus should be want your child to communicate. And that's why some parents who their children can sing, recite nursery rhymes, recite alphabets, they think the child is progressing in milestones in language. But sometimes the child may not be progressing. It's when they begin to focus on communication. Yes, the child can sing, but can the child use the words that they know functionally to interact with their environment and with people? If they cannot, that child is not communicating effectively. So you can have a child who can say one single word, and you can have another child who can sing and recite nursery rhymes. The child with the single word sometimes may be higher when it comes to language development compared to the one that can sing and recite all the alphabet. How do you know that? If a child can sing, oh, Johnny went to the house and took the ball and put it on the mat. A child can recite a nursery rhyme like that or sing a song like that. If you give the child the ball, the mat, and all those things, what the child is singing about, can they demonstrate it? Do they have an understanding of what they are singing? If they are not, if they don't have that ability, that means that that child does not have the language level that you think they have. So you can't tell me that that child, oh, has a language level of sentences and things like that. You can't. Another child may be at the level of maybe just using single words. But if you give that child a ball, a mat, and tell that child to carry out that instruction, the child can take the ball and put it on the mat. The child understands, even though when it comes to communication or language level, the child is just using single words. So you see why communication is the most important thing, because it helps you to understand the real level of the child and understand where the child is and how to begin to help them to build. So that's why when we focus on communication, even if the language or the words are less for their age, first focus on communication. So communication is like, so you're not trying to build a bridge across that deficit or that delay using other strategies like sign language. So when we are using this alternative form, it doesn't mean that we close the door to them building their language. It just makes it easier that we're building a bridge across that deficit while we help them develop language. So as we use sign language, we use words. So it's easier for them to see when you're signing something. Then you now use words to describe what you're saying. So with repetition, with modeling, with patience, they're able to associate those words with those gestures. And as you say them repeatedly, so you don't just sign, you say and describe what you're signing. Of course, depending on the child's level, you start small. What do? You start with their basic wants and needs, basic daily interaction. So if there are basic wants and needs or basic things that they like, you associate a sign to them. Of course, we have the standard sign language. However, when you're trying to help a child with communication or language, you don't necessarily need to use the standard sign language. You can create a sign for your own. You can decide, I know for like this that means more, but you can decide this can be cookie for you. This can mean a drink. Just look for something that is easy for the child to sign, and also that will be easy for people around you that are partnering with you to help your child to also sign. Everybody has to be consistent. So if you want to use the standard sign language for things, you can, or you can create your own and make something that is easy for you to be able to communicate. So building a bridge in that area is that you're trying to create an alternative form of communication for the child that the child can still can model. And as you use words with those signs, the child can be able to can model language for them while they develop language. Also, PECS, what we call picture exchange communication system. The concept is just using pictures to for a child to be able to identify things. So the pictures can come in flashcards. So sometimes they sell some of these things. These days, some people have them on devices. You get into the AAC devices. So you can create your own pictures. You can take pictures of things around the house and print them, or you can get flashcards of common things that the child interacts with or the child uses every day, such that you make it easy. It's like you have created a bridge. So if the common things that the child requests for, you can get pictures. So when the child is trying to communicate their wants and needs, instead of the child getting frustrated and you also getting frustrated, you put those pictures in places where the child can have access to. Most schools as well, you will see that most schools, when part of their intervention is to create pictures of the common things around in school, common activities that the child will do, they have pictures that would describe those things or demonstrate or create a visual expression of it. So a child can easily point to you that this is what I want, or maybe I want to go and play, or sometimes I want to go to the toilet. The child can easily point. So when the child points to it, then you now verbally describe what they are pointing at, or what they are showing on the picture. So you can get flashcards of the child's common things. You can take pictures with things around the house, such that you are creating a bridge across the communication challenge or language delay or deficit that the child has. So when it comes to communication, you need to create an alternative way of expression. While you now use that, you now demonstrate as you are showing those pictures. So of course you can take pictures and laminate them. Some people put them in folders. Some people, if they are common requests, like maybe they're food items or beloved things like toys or things like that, you can put the pictures around the house. You can put it on your fridge. A place that is accessible for the child, and when they need it, they can point to it. And of course, when you're not sure if the child is trying to request something, bring those things and you point to it and say the word. Point to it and say the word. With repetition, with modeling, with patience, the child can associate those words with those items and they begin to model. Even when it comes to building sentences as well, of course, part of the process of building sentences is also introducing the child to common words, common activities with sentence. So with seeing them, so because text can even graduate to sentence form, describing something in a picture, the child will be able to associate those activities with those words. And as you model and repeat, you're able to model correct use of language for them. Also, we have what we call AAC, the augmentative and alternative communication. These days, they come in form of apps, and before they were commonly just devices like tablets, where so it's like having pictures or text in tablet form. So they come with a tab, but these days we have them as apps. So most times it's not all the time you need to purchase the tablet for the AAC. Some people now have them as apps that people can download onto their devices and the child can use it. Most times people it comes to that with a device or a tablet such that we just like is for the child can use it solely for that purpose. But there are some these days that come with apps that you can just download it onto a tablet. But because the child will be using it almost all the time, it's better for you to have a device that is dedicated to it. We have different types, of course, and this is not something that you just go and buy and just start using. It's always better to work with your professional that are working with speech language pathologists. They can, and because we have different types, sometimes you have to test more than one and know the one that is best suited for the child. Some children will gravitate to some will not will gravitate to the other one. So you need to test it. And also know that the fact that you are creating this alternative, I don't believe that you should shut off the possibility of language. Especially if a child has language or a child can talk or can even can make sounds, can use words. To me, it should not be used as a replacement. It should be that why I said augmentative. It should be able to augment. You use it together. So even in your therapy, in anything you're doing, your interaction with the child, you still use words, you still model language use for the child. Not that you just make the child dependent on the pictures and dependent on the devices. And once they just point to it or they just press on the device, because most of the time when they press the device will say the word or the thing. Still model language and still interact with the child, and model that language and help them to be able to repeat those things. So it becomes like an augmentative device. It augments the process of language development, not that it should replace it. The same thing even with sign language. When you sign, don't just sign, use words, model language. Also, gestures and visual cues. You can use visual charts, you can use visual cues around the house, and use gestures as well. But always use language when you're doing any of these things. And remember the principles when you're using language. You need to be loud, you need to be expressive. You can see the way I'm talking, because when you do that, you're modeling language for them. We also have other applications, things like Gemini. These are speech applications. And if you see most of those applications, you will see that they are modeling words and they'll be showing the mouth because it's like you're modeling the expression, the pronunciation of those words for the child. There are also ways of building communication bridges. You are building a bridge across the language delay or challenge the child has to help them to be able to communicate, which is the other side, which is the main goal. The main goal of language is functional communication. So if the words are not yet there yet, we create alternative forms of communication so that they can express themselves, their wants and needs, and interact with their environment while they build language. So when words are not coming, that doesn't mean the child is not communicating, like I just said. So the child can communicate beyond words. So bridges like pictures, gestures, and apps will help them to express their needs, their feelings, and their choices. They don't replace speech. They prepare the way for it. So every child can communicate. Their job to make sure that they have a bridge that they can use to do. Okay. So now let's talk about managing behavior. Of course, the first thing is that every behavior is a communication. Let me say that again. Every behavior is a communication. So if a child is although sometimes we call maybe say unwanted behavior or inappropriate behavior, but every behavior is a communication. So sometimes because children that goes with autism have challenges communicating, So the behavior is their own way of communicating. Of course, that doesn't mean that we just say, okay, the every behavior is a communication and we don't do anything about it. But that understanding is first of all important because it helps us to be empathic and it helps us to be able to help them create strategies and bridges that will help them to communicate that behavior and will help us also to identify the behavior. Because once you can identify the behavior, once you can name it, then you understand how to help the child. You know, of course, I wanted to talk about meltdown and tantrums. These are often used interchangeably, but a meltdown is not the same thing as a tantrum. Almost all children will have tantrums, but sometimes they can look very similar. You know, sometimes when you on social media, there have been videos that would have been that people often circulate around from time to time. You see a child going to a store, the child is throwing the TV, damaging things, and you see parents come for the child. My child cannot even try it. This child is just spoiled. They need to hit the child and things like that. Most times that child is having a meltdown and not a tantrum. They can often look the same. They can look the same, but most times, children that have developmental delay, children diagnosed with autism often have meltdown. And this is the difference. They can look the same from the outside, like if the child is throwing themselves on the floor, shouting, crying, and everywhere. But the difference is that for a tantrum is associated with a need. So maybe a child wants a cookie or a lolly or something, and you don't give it and they just start crying. Often, when you give the child what they are requesting for, they will stop crying. However, when it comes to a meltdown is not primarily because of a need. Well, let me not say a need. Let me not say not a need, but it's primarily due to overwhelm. So the child is overwhelmed, and most of the time, children diagnosed with autism have sensory overwhelm. The sensory overwhelm can be external and can even be internal. So even when you give them something, it's more like there's really nothing that pacifies that meltdown. Excuse me, behavior you're seeing, the shouting, the screaming. So it's like you try to give, okay, you want to give them cookie, they don't take it, give them their favorite thing. It's like you try different things, nothing in quotes seems to pacify them. And you're wondering what does the child even want? The child might even be crying more. Because what is causing that meltdown is not a thing. It's not one thing. So you can't just, it's not a need for a thing. So, or let me not say it that way. It's a need for regulation. Let me put it that way. So that's why I'm trying to avoid saying it's not a thing. It's not a physical thing. Maybe that's what I'll say that. It's not a physical thing like you give them a lolly, they stop crying. You give them a drink or you give them a picture or a toy, the child will stop. No, so, as some of the videos I've seen on social media, there was a child that was in a store where they were selling, I think, electronics. Have a lot of, you know how electronic stores are. Stores where they display the electronics. They have a lot of screens in those kind of stores. And most of those screens, they have big screens. And most of the time, those screens are always on, if you notice. And a lot of things will be playing on those screens because, of course, that's what they do in that store. They sell electronics. So they need to have a lot of those screens on display and have those things playing. So sometimes it could be that child, because one of the things that overstimulates or causes sensory overwhelm for children with autism and other developmental challenges are some of those lights. That is form of like a visual stimulation visual. So the child is overstimulated because most of these screens are smart TVs. So they can be very overwhelming. They can be hyper stimulatory. So, but because maybe the parents or whoever did not understand that, so that kind of child may not thrive well in such an environment. Of course, initially when they get into the store, they may not know. And the interesting thing is that the child may not be able to communicate that this screen is disturbing me because sometimes the child does not even know. Maybe over time, we train, with therapy, the child is able to be trained to understand the things that get them overwhelmed, especially when they start developing functional language or functional communication. They will begin to understand themselves better, identify environments that are not suitable for them. So that kind of child, like, it's possible that all those visuals, all those screens are creating visuals hyper stimulation for the child. And what happens is that when the child gets overwhelmed, they have what we call the flight or fight response. Their sympathetic nervous system, sorry if you're not medical, it just goes, I don't know, let's say goes over, they become hyper, hyper stimulated. And that's one of the things that will cause the overwhelm for the child. And so that throwing of things, that's, all over the place, to be honest with you, is a communication. And most times they cry for help. But I know it doesn't look that way because the overwhelm of the child can even overwhelm people in the environment. So the solution most times is to find out what is causing the overwhelm and find a way to help the child regulate. The thing is that if you don't pick it early enough, sometimes you just have to allow the behavior to run the course. The best thing is that if a child has those kind of things often, try to study what happens like the 30 minutes or 1 hour prior to that behavior or the meltdown you're seeing. Sometimes there might be a pattern. Some children have a meltdown at certain times of the day. Even in school, I've had clients who say the child is having an overwhelm in school at certain time. I say, okay, check it. Is it in the afternoon? Because sometimes things like stress, things like hunger can be part of what is causing the overwhelm. So that's why children need lots of breaks, So if you notice that your child is having meltdown at certain times, especially during in the afternoon, after like long day in school, long day of activities, it may be that they are stressed, it may be that they are hungry. So if you notice a pattern, you are able to either redirect that behavior or even completely prevent it. Or children will even show signs before that behavior will happen. I'll tell you a story. I've been in an exam hall before, and that was one here in Australia, and someone behind me had a seizure in the exam hall. Person literally had a seizure. That's called the ambulance and paramedics. And as the paramedics came, they took him and all that. All of a sudden, it just occurred to me. I noticed that a fluorescent light just the person was right behind me. So the fluorescent light was just above me. I noticed a fluorescent line that was bad. You know when this fluorescent line, when it's bad, it starts twitching. You know that twitching. Do you know that that could have precipitated seizure? So if that kind of person, if it was really, if maybe he got into the exam hall and he noticed that he should have just told the examiners or investigators that this is gonna affect me. That change his location, or they deal with that thing there and then. So it's the same thing. When the child begins to grow and understand, some of the things that get them overwhelmed, they may be able to, redirect themselves from such an environment instead of waiting till they get a meltdown. Okay, so focus on regulation, not just discipline. So you don't just say the child is discipline the child. No, help the child to regulate. Because when it comes to meltdown, it's not that the child is being spoiled, it's that the child is overstimulated. So activities or things and environment that help them to stay regulated is what they need. What are some of the tools and strategies that we can use to go visual schedule? Because sometimes some children also may have a meltdown. There's something we call demand avoidance. We have pathological demand avoidance, PDA, and some children with autism often have that. Some may just have demand avoidance, but there's one called pathological demand avoidance. That means that, you know, getting them to do things, they can just throw a meltdown when the demand to do certain things is high, especially things that they don't have enough skills to do or things that they don't even have interest in doing. So things like a visual schedule, trying to create more predictability, trying to describe what you want them to do. It helps to manage behavior. It helps to create a bridge across the behavioral issues that a child can have. Sensory spaces. So sensory spaces are spaces that will help them to be regulated. So it creates a sensory friendly environment, not an environment that is overstimulatory. When it comes to senses, think of all your senses: sight, smell, taste, touch. Of course, we also have what the proprioception, the proprioception, the vestibular, which is balance. Proprioception has to do with feeling your body in space of gravity. Then we have the interoception. Interoception is like your internal, how you feel internally. So, what we call the internal review. So things like, when you want to go to the toilet, you feel sometimes, how you feel on the inside. And sometimes children diagnosed with autism often have challenges in all these senses. So creating a sensory friendly space means that you create an environment that is not too visually stimulating. Some people have a lot of colors in their houses. Sometimes some children may be not all children, but some might be sensitive to those things like lights flashing here and there can be overstimulating for some children. Also auditory, like noise. Some people like things playing, someone like a radio or something playing in our background. Some children will be very sensitive to the kind of sound in their environment, things like that. So creating a sensory friendly place. If your child likes to move around a lot, you can have, mini trampolines around. You can have, weighted vests, weighted blankets. You can have these rocking chairs as well. So those kind of things help them, to regulate, help them to stay calm in the environment, help their nervous system to be regulated so that all the sympathetic overdrive that often precipitates some of those meltdowns are regulated. Also have simple and clear routines. So that's why things like visual schedules, chart would help. Let your routines be simple. Let them be clear. And to me, I also say let them have the same, let them be predictable. So even things like shower time, bath time, meals time, have consistent routine until when the child gains mastery. So when the child gains mastery, they can decide to do things however they like. But when you're still in the process, where you're still trying to get them to understand routines and how to do certain things, stay predictable. Let them be consistent. Let them be simple and clear, one step at a time. Okay, because for us, it may be so easy to do this and that. But for them, they need predictability, they need patience, they need clear routines. Then, of course, positive reinforcement. As simple as giving praise, giving a high five, giving a thumbs up, just smiling to acknowledge their effort. So positive reinforcement, acknowledge the effort, not just the end result. So if your child is someone who has always been having a meltdown, and maybe after they come back from school, they have a meltdown, and over time you have trained them that when they come back from school, they go and have a rest. And you see your child, just excuse themselves to go and lie down somewhere or go and play on their swing or their sensory toy. Acknowledge those things, give positive reinforcement, acknowledge their effort, and when they're making progress. So see behavior as a message, not a problem. Like I said, create predictable environment. Because some children with autism they struggle with transition. They struggle with transition. So let your activities be predictable. Let them know what to expect. Don't just change things. If you're going to change things in their room, if you're going to buy a new toy and throw away the old one, carry them along. Those are some of the things that cause behavioral challenges. So use tools that will help them to regulate. So, like I said, a meltdown is not a child being difficult, it's a child in distress, it's a cry for help. So you have to be empathic and understand that that behavior is a communication. So you need to be able to interpret that behavior and help them to meet the need. Okay. When we understand what triggers behavior, we can prevent many of them. When you understand it, you can prevent it, you can or redirect them or manage effectively. So I talked about bridges like picture routines, sensory corners, create shared choices, makes them feel in control. Our job is not to just manage the behavior, but rather to equip them with better tools for handling frustration and change. So that's why when you understand what they're trying to communicate with the behavior, you are now thinking, okay, is there another way I can help them to communicate without actually putting this behavior? So that's where some of those visual schedules coming. So if we talked about for language and speech earlier on, we talked about the picture exchange, the sign language. So those are ways that they can express their needs themselves. They can communicate what they are trying to do. As simple as gestures. Some children may be having a headache. That's why they're head banging, and that's why they're having a meltdown. They may be having tummy ache, especially when the child struggles with constipation or things like that. So they as simple as gestures and touching their tummy, or touching their hair like this. That's a gesture. I can say, okay, this hurts or something. So helping them to be able to communicate their frustration, and express themselves will help. So not just that you want to manage the behavior, you want to understand what they're communicating with that behavior and help them to either redirect or express themselves in another way. Okay, then we'll talk about building bridges for social and life skills. This is very important. Life skills, life skills, life skills. So what are life skills? They are skills, as we call them, skills we need to function in life. So things like daily, we call them activities of daily living. Skills that help you to be independent, skills that help you to function on a daily basis, as simple as dressing, feeding yourself, toileting. All these are life skills. These are skills that will help a child to be able to live independently or function and care for themselves independently. Social skills also. For a child, you can start with things like turn taking, even eye contact, greeting, skills that you need to interact with your world and the people around you. Okay, so what are the practical bridges we can build across challenges with life skills? Visual charts. So life skills like dressing, eating, toileting, daily activities of daily living. Having a visual chart that describes the steps of what you want the child to do. Of course, you need to know your child's learning style. is your child an auditory learner? Most children diagnosed with autism will say that they are visual learners. But I also believe that what that looks like is also different. So you don't just say because my child is a visual learner, and I just get a chart that has everything described. You need to understand how the child also learns. Some children, even though they are visual learners, they like visual representations that are very clear, that are very step by step and simple. Not just have a chart with colors and there's so many things going on the chart, because that may also be very distracting for them. Okay, so you need to understand what routines am I trying to teach. If I'm trying to teach dressing, for example, can I create a visual chart for the step by step of, okay, first of all, how they wear their shirts, how they wear their shorts, and step by step dressing themselves. When they come out from the shower, they towel, they cream their body. So you can even pick them one after the other. You can create a visual schedule for just creaming your body or applying lotion to your body. When we get that, wearing your shirt, button up. So take it step by step. When it comes to toileting as well, you can create a schedule. When you get into the toilet, when you sit on the toilet, when you wiping, you wipe 3 times, you throw it to flush, you wash your hands with towel, maybe some hand cream. That can be a schedule. Things like brushing teeth as well. You can break it down. So when you enter, you pick the toothbrush, you pick the toothpaste, you put the toothpaste on the toothbrush, and you brush left side, brush right side 3 times, left side 3 times, up 3 times, down. I mean, however you want to teach it, then tongue 3 times, then you rinse 3 times, and rinse the toothbrush, put it back, and wipe your hand. I mean, create, so that's why I said that let your routine be simple and predictable. So when they are simple, if you are using visual charts or you are even running commentary, it's very easy and you follow the same routine every day. So a child is having shower time. Don't today you use the toilet first, you shower, then you brush after. Tomorrow you enter the bathroom, you brush first, you shower, and you toilet. No. Create the same routine, at least for starters, until the child can gain mastery of those skills. Then they can decide however they want to run the routine. So visual charts will help. Role playing games will help. So that's where play comes in. Of course, you can get role playing things like a dolly, all this dolly that you're showering the dolly. So part of the role playing, how do you shower the dolly? You put soap on the sponge, you wash the hands, you wash the armpits, you wash it, then you pour water. That's like describing what you're trying to do. Even brushing teeth, you can get a dolly and role play it and model and demonstrate it. Put the toothpaste and do this and that. You are demonstrating for the child, they are also doing it as a form of play. So when it's time for them to do it in real life, they can picture the activity, to what they are expected to do. Then social stories. There's what we call social stories. So what are social stories? Social stories just have to do with you creating a story around maybe a skill you want to teach or a concept you're trying to teach. So you can write them as a story with the picture. So most times, most professionals that work with children, your therapist, your speech therapist, your occupational therapist, even schools as well, they use it. But it's something you can even do as a parent. You just create a story around. So, for example, if you are going to someone's house or you are going to a certain place and you expect a certain behavior from the child, or certain expectations, you can create it as a story. Like when Johnny went to visit his cousins, when he entered, he said hello to everybody and he called them to do this. He shared his toys. So the story is like creating a story form of expected behavior or expectations for the child. So that gives a child a picture, an example of how they are expected to act in certain situations. So for different things, you can create a social story. Or if you're even trying to teach a child a concept, you can create a story around it and tell it as a story. But it's nice when you are telling the story, there's pictorial representation or description of what you are trying to tell. So the child can can follow the story and see the actions that were in that story. So when they are also in that setting, they would understand the actions or the behavior expected of them in all those settings. So most times you see schools create social stories, therapists create social stories, especially if you say that, okay, I'm having challenges with my child when we go into this setting or we're going into this environment. So they can create a story around, going to that environment, those activities, and the child is able to, understand how they're supposed to act in those settings. So I'm talking about visual timers as well. So you can put time to every activity. Okay, 8 a.m. Or that's if your child understands time. But if your child is not even at a point where they understand that time, or you can just put routine step by step. You can do things like, it can be simple. You can, if it's like a cardboard, you have a cardboard, use colorful markers and do it. If you want to go extra, you can either buy, sometimes they sell some of these charts that you can buy online, or you can laminate your own, create your own. You can make it a fun activity with your children. But the most important thing is that let it be simple. Or if you even have a notice board, you can have a notice board and you can write those things with colored markers. As they do certain activities, you can get them to tick it off, or you can tick it off. And this is where tokens or rewards can come. Maybe after they do 3 activities, give them a break or give them something as a form of motivation. But of course, don't always attach giving specific things as simple as praise and yay. But you can do reinforcement with giving them things. Or maybe for 5 days in a week, maybe on one particular day, there's a reward you get for being consistent every day. This week we're doing this routine. I mean, just be flexible about it. Most important thing is that you're helping the child to navigate across their challenge, and you are focusing on progress over perception. So note, break skills into small teachable steps. I talked about task analysis. Task analysis is just talking about you want to teach a particular task. You break it down into steps, like the brushing of teeth that I mentioned. So a task analysis, for example, for brushing teeth can mean when you enter the bathroom, what's the first thing you do? Pick up the toothbrush. What's the second thing? So that can be number one. Enter the bathroom, number two. Or you can even start your task analysis from what time do you want your bedtime to be? So you have maybe bedtime is 8 o'clock every day. So if bedtime is 8 o'clock, that means maybe your child will have their bath at 7:30. So if they're gonna have a shower at 7:30, you know that from something like 7 o'clock, all play should have ended. Toys should have been cleaned up. You should have had dinner. Depending on how you do, maybe your house have dinner before you shower, whatever your routine is. But let it be clear. Okay, bath time is 7:30. So from 7 o'clock, you can even start prompting the child. You have 30 more minutes to clear. Remember, I told you some children struggle with transition. So don't just come at 7:30. Oh yeah, now it's time to shower, pack all your toys. You can start having behavioral meltdowns or behavioral issues. But you should have been prompting from 30 minutes 30 more minutes for this, 15 minutes for this. So by once it's time, you have prepared them. Okay. Over time, they will get the concept. And once you enter the bathroom, what's the first thing? Pick the toothbrush. What's the second thing? Put the toothpaste on it. Third thing, open yourself and wet the brush. Whatever yours is, just create those steps. And even brushing, left, right, up, down, whatever routine, but stick to one until they gain mastery. They can now be flexible. Then, so create task analysis to be able to teach those things. Then use consistent visual and hands-on teaching. So consistency, patient modeling. So and demonstrating. Some parents will say, okay, my child watching a video would help. I try to avoid screens as much as possible. Anything that your child can learn off the screen, I would rather they learn it off the screen. I would rather prefer get a book about it, get visual schedules around it rather than screens. Because of course we know the dangers of screen, the dangers of screen. Screen are hyperstimulatory, they rewire the brain and things like that. So as much as possible, things that they can learn outside the screen, let them learn outside the screen. Excuse me. So practice in safe and supportive environment. Very important to create the right home environment. A right home environment is a functional home environment, is a safe environment, is a supportive environment. Of course, when we talk about the right environment, both external, no, not external, let's say both physical and non-physical. So the physical and the structural things, the arrangement of the house, you need space, it has to be sensory, support sensory regulation, not hyperstimulation, not lights flashing in one place, sound flashing in one place, not like they're just decorations anywhere, no space to play, no space to run around, no appropriate toys, appropriate books, appropriate resources around, just marble floor, chandelier, all those things are not functional environment. Let the home be safe. So if your child is hypersensitive as well or hyperactive, so you need a home environment that is safe, safe. Things that can harm the child should be out of the environment. Supportive environment. If you have people staying with you, everybody has to be on board to support your child on their journey. Of course, non-physical aspect of having a safe environment. What are the words that are being spoken in the house? I know it can be very challenging, supporting a child with developmental challenge, but you need to watch your words, watch your expressions, it must be a home filled with love, there must be love, there must be patience, and let it be a full peace. Let it be an environment, that projects hope and support for your child. Because you'll be amazed. Some children have had um I've said even yesterday, I think Mrs. Fumike Alabi, our speaker yesterday, was saying that, her son, when he started communicating, there were things he was making reference to. And I've heard people say that a lot, when they were pre-verbal. By the time they become verbal, they'll start quoting what someone said years ago when they were not verbal. And all those things, the child is taking it in. And remember, words, words are spirit and life. So whatever you're saying, you're giving expression to it. So the non-physical aspect of the home is very, very important. Thriving is not just about academic skills, it's about daily life. I know parents are always so stuck on learning, reading, academics, but for a child to thrive, daily life is very important. So teaching a child to ask for help, to use the toilet, to join in a game, it will take time, but you need to be patient. So you trying to build a bridge across that challenge using charts, role playing, social stories, it makes those skills easier to learn and more enjoyable to practice. Now let's talk about building bridges academically. No, yesterday, Ms. Sonika, she did a great job. We had a great conversation yesterday about bridging learning gaps. So I mean, if you didn't watch yesterday's session, I will advise that you go and watch yesterday's session. It was a wonderful conversation, lots of learning points from yesterday's conversation. So I'll talk about the concept of learning hindrances, differences, learning difficulties, and learning disabilities. Sorry, excuse me. Let's also have something to drink, my food. So yes, so when we're talking about, excuse me, building bridges academically or building bridges across challenges with learning, there are concepts that we need to bear in mind. Learning hindrances, learning differences, learning difficulties, and learning disabilities. So I said here that learning hindrances plus learning differences plus learning disabilities often leads to learning difficulties. So children with autism sometimes have challenges with learning. So yes, we have some extremes. We have people who are hyperlexia, they're very skilled in maths and often even maybe gifted or genius level in some areas. But you know that a child even being gifted or being extra academically can also be a challenge. So what are learning hindrances? Learning hindrances just have to do with things that can hinder learning. This can be external things or even internal things. External things like screen. I talked about screen the other time because screen rewires the brain, it can impact on a child's ability to learn, cognitive ability. It rewires the brain, so it can impact on their cognitive ability. So that's why if a child has developmental delay, speech language delay, even cognitive delay, avoiding excessive exposure to screen is very important because that screen, you think that screen will enhance learning. It actually does the opposite because screen is an illusion. The way God designed us to learn is to be able to use all our senses to interact with our environment and be able to learn. So when you put a child on a screen, you're shutting off all the other senses. True interaction is not taking place. So true learning is not taking place. The child is just consuming. The child is not interacting functionally. So true learning is not really taking place. So that can be a learning hindrance. Not also having the right environment can be a learning hindrance. What are the internal things that can be a learning hindrance? I talked about the different senses, the interoception, which is the internal environment. So having maybe some ongoing medical condition internally can hinder learning because if you are not feeling yourself appropriately, if you are overwhelmed, just imagine that you're having like headache, for example, or you just feel you're just feeling unwell. You can't be so present to be able to learn. So sometimes children with autism have things like hypersensitivity, they're hyperstimulated, they're overwhelmed, because some of them are hypersensitive, they're sensory seeking. So they cannot interact effectively with their environment because of the internal things that they have. Some of them also have, ADHD, hyperactivity associated with their condition. So that can be a learning hindrance. This is important because in order to build a bridge across a learning challenge or a learning tool, you need to understand the scope of what is happening, what you're doing. That's the way you can effectively support a child. So learning differences mean them learning differently. I told you that one of my favorite quotes is, if a child doesn't learn the way you teach, then you teach the way the child learns. So understanding that a child learns differently or the differences in their learning, we have things like the concept of the left and right brain learners, the right brain theory. Often, children with autism, some of them are right brain learners. A lot of them tend to be right brain learners. And what right brain learners means that there's a way in which they take information in and they store that information to be able to recall. So if you don't teach them with the appropriate techniques, they may have challenges with learning. So because the right brain is more visual. So if a child is a right brain learner, that means that in teaching them concepts, they do well with a lot of visual. That's why you hear people say, oh, children that know the autism, most of them are visual learners, they learn well with visual aids and charts and things like that because they're right brain learners. And because the right brain, does well with pictures and things like that. So when you're teaching them something, if you teach it in pictures, in colors, it's kind of like it stamps in their brain. So they have like a photographic memory. So they learn in pictures. So they can learn that thing and like store it in that picture form. Compared to when you're just teaching like plain blank no colors or anything, and just words, no drawings, no description, it becomes difficult because they will learn at that point, but they can't really store and recall. But when they learn in pictures, it becomes easy for them to be able to store it. And when they want to recall, they can easily remember. Remember, some of us, when you're studying in school, you study a diagram. There's a way you study that you learn the concept by studying a diagram. When you get to the exam, when you want to recall, it just becomes easy for you. All you don't need to do is just remember that diagram. Once you remember that diagram, you can just remember that concept. So it's the same thing. So learning differences have to do with them learning differently. So you need to understand this difference. That would help in building the bridge across any academic challenge. Of course, when we talk about learning disability, I know people always talk about when it comes to this concept, what we always talk about, okay, is it dyslexia, dysgraphia, dyscalculia? We just want to bundle it that way. But I like to emphasize on learning difficulty. Of course, when it comes to learning disability, dyslexia, what are the things to look out for? The struggle reversal of letters, things like that. Dyscalculia, struggling with calculation, dysgraphia, struggling with writing, and things like that. But I believe that we should understand the concept of learning difficulty because the hindrance, the difference, and the disability often lead to the difficulty. So most of what you will be seeing is the difficulty. And when you see a difficulty, a child struggling to read, a child struggling to write or comprehend and understand, for me, don't just jump to the disability. Do you understand? It could be a hindrance that is impeding their ability to learn that is now manifesting as a difficulty in reading. So, for example, a child having challenges in reading, excuse me, may not necessarily be dyslexia. If a child, like I said, learns differently, is a right brain learner. So, for right brain learners, for example, some of them don't do well with phonics or only phonics. You can teach them phonics to learn their sounds, but in addition, you teach them with whole words because they have a photographic memory. They can learn words in pictures. So some of them will learn to read not just with phonics, but they will learn to read with whole words. Remember, Mrs. Funke Alabi was saying yesterday that when she was teaching her son, she was just stuck on that phonics level or the three-letter word cat, and not realizing that her son had more ability, and that's because he had a language delay. So it was equating that he wasn't really learning. So until she realized that don't stay on that level. So she started reading to him. She was reading books, reading so many things to him. But meanwhile, he had that ability. And by the time he was not able to read, she realized that all along that she was staying stuck at that level. He had more ability. What do you think happened? She kept reading to him, exposing him to rich literature and words. She's exposing him to more vocabulary, more words. I remember I said he has a photographic memory. So he can learn words in sentences, in big words, instead of just staying stuck at phonics. So the child having a learning difficulty or challenging reading, it's not just you don't just say it's dyslexia. Many people just do sometimes it's just dyslexia. Some people even have eye functional eye disorders, issues with eye tracking. and they will need things like vision therapy. So those kind of children, you would have just said they have dyslexia, but it might be an eye tracking issue that they're having challenges with. So when you have in order to build a bridge, you need to identify what you're dealing with, what is causing the difficulty. You need to get rid of the. Here I talk about address the learning hindrances, take away the wrong thing from the environment, enrich the environment with the right thing, understand their differences. Are they right brain or left brain learners? If they are right brain learners, are you teaching with the right brain strategies that can help them to learn appropriately? Identify any disability or underlying medical condition. Some children have associated medical conditions, things like ADHD, things like sometimes epilepsy, and to be associated with what is contributing to their learning difficulty or their struggle academically. Then you now implement strategies to enhance learning. So implementing strategies is now trying to now build a bridge. So these strategies are what will now build the bridge across the learning challenge. But you can't just build a bridge across what you have not really identified, because what will inform the bridge you're building or the strategies you're implementing will be based on all these other areas when it comes to learning. So I talked about catching up academically. So in catching up academically, in implementing strategies, you need to identify their learning gaps. So when you understand what you're dealing with, like you identify, okay, they have this difficulty, identify the hindrances, take away the hindrances, like I said here, understand their differences. Understanding their differences will help you to know how they learn, identifying any underlying medical conditions. And because sometimes treatment may be associated with some of these medical conditions. Then you now identify the learning gaps. Know how your child learns. Yeah. Yesterday I was talking to Mrs. Fumika Alabi. She was saying we're discussing about learning gaps. Don't just say my child cannot is struggling with reading, my child is struggling with math, my child is struggling with English. What is the gap? You need to understand learning areas for every subject. So you can pinpoint what area are they struggling with. When it comes to maths, for example, we have 5 learning areas in maths, regardless of whether it's kindergarten to the year 12 or SS3. It's the 5 areas, but you build up as you go. So you need to identify the learning gap we are having. When you have dealt with the hindrances, the difficulties, and the disabilities, then how your child learns. You need to know their learning style. Learning style, are they visual learners? Most children with autism are visual learners, but not all the time. And even when they are visual learners, don't just bombard them with charts and books that are colorful. I also always add how they also learn, not just their learning style. Curriculum breakdown, how the layout is. This is there's a whole that you need to do regarding it. So you focus on their strength and you build on their interest. You build from strength to weakness. Find something. So don't just say, oh, they are not good in maths and something like that. Find a strength, find a starting point. Look for interest. You understand? So if they are struggling with writing, she was saying yesterday, her son has challenges writing, even as old as it is, but that is not stopping him. Okay, while they are building on the writing skills, she's exposing him to literature, she's exposing him to learning those subjects in other ways. Embrace things like typing. So talk about hands-on, repetition. So use visual. So balance academics with functional learning, because learning is different from schooling. Is not education and schooling are not the same. The goal is for a child to learn, and learning is not just focusing on academic. Learning is equipping for life. Okay, so you bring things like customized learning plans. So when you are implementing your strategies or building the bridges across their challenge, that's where the IEP comes in, individualized educational plan. Or you can cost, I believe, is a customized learning plan. I believe every child should have one anyway, regardless whether they have a developmental challenge or not, because that helps you to customize learning to the child, how the child learns, their learning style. Some children do better with certain curriculums because of the way the curriculums are laid out. Bring in visual learning aids. So visual learning aids will help to describe and give expression to what you're trying, the concept, so because the child can see and hear you describe it. Then talk about multisensory activity. Multisensory activity has to do with you are teaching a concept using different senses. So, for example, you are teaching the maybe alphabet or any concept. You say it, they see it, you can write it, you can draw it. I mean, different ways of expression. You are teaching math. You can use manipulatives, your maybe your linking cubes, your abacus, or your rods, or counting things. You can describe it, you can draw it, you can say it in a story form. they can interact with the concept in different ways. Also, progress is individual. Okay, don't compare a child to another. That's why I said progress over perfection. Okay, progress over perfection, and celebrate each progress that you did. Academic learning should feel doable and not stressful. So use manipulative, use real life example, interest-based learning. So you can tell the things in different stories, like Fumike was saying yesterday. You know, living books, math. You can even get living books for math, which is like math in a story form. There's even a concept called math as a language. We don't have the time to go into all those. So teaching math as a language, not just as cramming tables or things like that. Okay, so use different forms depending on what we are dealing with. If we're dealing with a reading challenge, then we are build to build bridges across the reading challenge. We have to find out, is there a learning hindrance to the reading? Is there a learning difference? Is that they learn differently? That we're dealing with. Is there a disability? A learning difference can even be handedness, for example. Some children are left-handed, and you switch your child to right-handed to start using the right. That can cause a learning difficulty for the child. That could be what the child is even dealing with. I've had parents who are struggling with it, or who their children are struggling with that. So you need to know all those things to be able to build a bridge across the challenge. Not every child will follow the school standard pace. So instead of forcing a child to fit into the system, you adjust the system to fit the child. That's why I talked about, if a child does not learn the way you teach the way the child learns. Unfortunately, school may not be able to do it right away if you as a parent don't learn how you can effectively partner with school. So that's why you need knowledge as a parent to know your child, understand how your child learns, what your child is dealing. So when you take your child to a school, you can go and introduce your child to the school, and you can effectively partner with the school. You can work with them to implement some of these strategies. You can also set the expectations. Your child doesn't necessarily have to do 9 subjects like every child is doing. You can reduce the load, and you can customize learning to your child's ability. Of course, other options, home education is another option. This is Fumika Alabi that came yesterday. She's a home educator. Our children are homeschooled. Of course, maybe not every parent can embrace that, but some children will thrive better when they are being homeschooled, because you are able to now individualize and customize learning to them and their ability. So in catching up and thriving, we've talked about building bridges across developmental delay, across all the developmental milestones that a child may be delaying. So I want to now just try to wrap everything up and say catching up and thriving when it comes to developmental delay, building bridges to help them catch up and thrive. We tackle it from different areas. Tackle things like from the brain, from the senses, from the hand. So for example, for speech now, even though speech, you just think speech is talking, but no, speech something has to do with the brain. Everything is connected to the brain. So that's why in building the bridge, in helping the child to catch up, you have to think about different areas along the line of that milestone development. So when you think about speech, for example, we have receptive language, we have expressive language, you have processing. So if I talk to you and I ask you a question, how are you, or what did you do today? That's receptive. Taking my information, you process what I'm saying, and you're able to respond back to it. So in building a bridge, you need to tackle things from all those areas as well. Things like even reading and writing academics that we talked about. Academics is not just the child is struggling to write, you just hold the hand and you're writing. That's reability. No, you have to think about it from the brain, because everything begins with the brain. Senses as well, your eyes, your ears, even when it comes to speech and language. That's why most people, you would have, if your child had a language delay or speech delay, they have told you to go and do hearing tests. If your child is struggling to read, you do visual tests and things like that. Even things like balance and coordination. Because if you cannot balance and be well coordinated, that's why you see a number of children who have autism, they are very like restless all over the place. They look very clumsy. Some of them, it's a balance issue, which has to do with their proprioceptive vestibular system. Okay, and even their the ear, because the ear is not only for hearing, now. The ear is also for balancing. So you need to tackle in this area. The child is having problem with balancing, are there activities that we can do to help them to regulate, better regulated, so that they are better able to be present and to be able to learn? Of course, the hand as well, things like in writing, not just holding a child's hand. Could be muscles of the hands that are weak, could be the reflexes of the hands that are weak. So my point is in helping a child to catch up and to thrive, you need to tackle from different areas. If you're building your bridges, you need to understand the areas along the learning of that milestone so that you know how to build the bridges. So I also talked about in catching up and thriving. Part of the process is also checking foundational milestones because sometimes what you're seeing as a delay now, it's actually a foundational problem. I know in academics, you talked about the child may be struggling to read and it's a foundational problem, but also even in milestones like speech, language, even behavior, So you need to check foundational milestones and skills. For example, if your child did not crawl, even if they are walking now, it can affect their language development and learning later. Because one of the functions of crawling is not just walking. Crawling is not just a prerequisite to walking. Crawling is one of the activities that helps to build the brain, seeing both sides of the brain, develop the aspects of the brain that a child will need in language, communication, and learning. Hmm. So you can't just build a bridge across their deficit now by just doing all those things that I said. Yes, they're important, they are doing them. But one of the things we also do, we check foundational milestones and foundational skills. Okay, these are the things you do when you do an assessment with a professional. And even some of those things you can begin to even build a bridge now. So if a child did not crawl and that is identified, even though they are walking now, you introduce activities that encourage that crawling, that activity again for them to do. Also, even when it comes to emotions and behavior, some children will struggle with emotional regulation and behavioral regulation because in the first 2, 3 years of life, when they should have built those skills through attachment and presence of the parents and the caregivers, that was not there. Because social and emotional is foundationally built in the first like 3 years of life. But the interesting thing is that because we may not know because the children don't need that skill at that time. So some children from when they were born, there was no time spent enough with their caregivers or their mom or their dad. They started daycare at 3 months or 6 months. They spent 6 hours a day, 10 hours a day in daycare. Those things affect emotional regulation for children and causes problem behavior. So that's why you will notice, if you interact with people who are in daycare and creche, quite a number of children tend to begin to have behavioral issues. If you trace it back, a lot of them did not learn to build emotional regulation because that attachment to their parents that's supposed to create that stability of emotions and behavior regulation has not been there. So sometimes, so of course, I don't have time to go into the attachment theory. So the attachment theory is just, I'm not talking about attaching gumbo. I'm talking about the fact that as a parent, as a caregiver, you are a source of succor, stability, regulation, primarily. You are the primary source of succor, regulation, stability for your children. So that's one of the ways a child will build those skills. So that's what we're talking about, checking foundational skills, check foundational milestones. We need to check all those things. Then identify areas of behavior. Sorry, excuse me. So identify the areas of difficulty. So to build a bridge across a difficulty, you need to identify the area of difficulty. So you're able to build a bridge, build a support system, strategies across it. Then for subject-based learning, because that's talking about learning. I talked about you identifying the learning areas of challenge. So then you can now build a bridge across the challenge. If they're having challenges reading, for example, you can read to them, you can expose them to picture form of expressions and learning. So if that is you are building a bridge across that challenge, you're not just sitting that the child cannot read. Itself, identify the learning areas of challenge. If there's a challenge with writing, while you're putting all the resources and strategies, you can build a bridge by teaching other skills like typing. So building a bridge is you are bringing in tools and strategies to help the child overcome that challenge. You are creating alternatives as well. Do you understand? So even your therapy and your interventions are strategies of building a bridge across the challenge to help them move to the other side. Then you tailor your intervention to the areas of need. Like I said, identify what the areas of need are, all the needs are. Then you tailor intervention, your strategies and your tools and your resources to this area. Also, I wanted to highlight the importance of partnership with schools, educators, and health professionals. I know that yes, we likely have parents here. I know we have educators here as well and health professionals, but it's important for parents, for families, for caregivers to create the right environment and also partner effectively with the right medical professionals and educators because the school as well is an environment for the child. So you need to be able to partner effectively with your child's schools and their therapists, their medical professionals to be able to achieve, results for the child. I always say, as a parent, you are the pilot. To me, you are the most important person, even in the team. When it comes to your child medical, there's something we call MDT, multidisciplinary team. So in the medical space, when you have more than one professional, taking care of someone or attending to someone, you call them a multidisciplinary team. The parent, as a parent, you are part of your child's multidisciplinary team. In fact, to me, you are the most important person because at the end of the day, you will make the decision of the school. Even if someone recommends the school to you, you make the decision. You make the decision of the location where you reside, even with your child, not your child. You make the decision of the therapist. You make the decision of all the professionals. So if you are not partnering effectively, if you are not getting knowledge, if you are not able to partner effectively with them, then I mean the outcome for your child thriving and catching up will be limited. And to check people who have testimonies on whose children are thriving, on people who as adults they are thriving and they have challenges even as children. One thing you find across board is you will see that they've had parents who were involved, who were informed, and they were involved and they partnered effectively with everyone working together with your child. So you are the pilot, every other person is a co-pilot, you are the core. So it's important to get knowledge and so that you can partner effectively with your child's educators, professionals, and everyone working together with your child. In conclusion, every child's journey is different, but every child has the potential to thrive. By building bridges, thoughtful support, step-by-step system, and a strong foundation of belief in their ability, they're able to create pathways that every child needs to thrive. Progress may not always be fast and easy like we expect, but it is possible. And it happens when we choose to show up consistently with the right tools and the right mindset. You have the power to build bridges for your child to catch up and to thrive. And you have the power you have the power to build bridges and you have the power to help your child to catch up and to thrive. So thank you everyone for joining me today. The last day of the Autism Renew Conference 2025. You can follow us on Instagram at Autism Renewed, on Facebook, Autism Renewed. Please like, subscribe to our YouTube channel, Autism Renewed by Dr. Lala. Such an honor to have everyone here. Thank you so much. I appreciate all my speakers from day one, day two to today. I appreciate my team. Thank you so much, Keith, for being amazing through this process. Thank you, everyone. Thank you, everyone, for joining today. And also, we have a community on Telegram. Thank you all to all the amazing parents, educators, and professionals that have joined us for this conference. Thank you, everyone that has partnered with us, helped us to spread the message. We are indeed grateful. Thank you, everyone. Of course, this conversation will continue even beyond this conference. Thank you so much. So, once again, my name is Dr. Lola Okeowo. I'm a medical professional. I'm a global autism expert. So I work with parents, children with autism, developmental challenges, how they can navigate and to thrive. I don't work directly with children. I work with parents because I believe an informed and empowered parent becomes a parenting advantage for a child to navigate and thrive. Of course, I consult with parents all over the world. I have clients in Canada, USA, Australia, UK, the UAE, Nigeria, everywhere, where I consult with parents to find out what's going on with their children and how they can begin to help their child to navigate. I also work with parents how they can partner effectively with the professionals. Because some parents will have amazing professionals, but they don't know how to partner effectively. how you can partner effectively, how you can measure progress. Sometimes it's very easy to know why your child is not making progress because they're not partnering effectively or they're not getting enough what do you call it, therapy hours, and how you as a parent can bridge the gap, because of course most times it's very challenging to get enough hours even from your insurance or from your therapist, but there's a way that you as a parent can partner effectively and maximize the therapy hours and resources that you have. I also work with schools and educators. I help them, to how I teach them how to I work with them to create the right environment to support children with developmental delay and special needs. And I also work with schools on how they can partner effectively with parents and caregivers. So you can reach out to me if you need any of my services. Also, look out for Autism Relief. We have several programs, coming up. I also work one-on-one with parents. Of course, that's a premium service where parents also work with me one-on-one with their children for a couple of weeks and months. And of course, very soon we're going to be starting our group program as well. Look out for it. All the information will be on all our social media platforms. Thank you, everyone. I hope you have a wonderful evening, afternoon, morning, whatever time of the world you're enjoying. Thank you, everyone, and I'll see you next time. Bye.